Welcome, everyone, to a program, Insights on Innovation for Self-Insured Employers. My name is Stephen Collins. I'm the CEO of MATTER. We are a healthcare incubator and innovation hub built on a belief that collaboration between entrepreneurs and industry leaders is the best way to develop healthcare solutions. Today, we have the third program in a series that we have developed together with one of our partners, Livongo, which is now Teladoc. The series, Insights on Innovation for Self-Insured Employers, is focused on the role of employers as healthcare companies. And in the US, half the population receives health insurance through their employers. And roughly 3/4 of those receive coverage under a self-insured employer plan, which means that those companies are bearing much of the risk associated with the health of their employees and of their families. And so whether they like it or not, US employers are effectively healthcare companies. One of the challenges that they face these days is that there has been really an explosion of opportunity. There are a ton of options of solutions with the potential to improve the health of their employees. But most of these solutions don't work together. And so it's on the employer, among others, to create a whole person solution for their employees. Some way to build a platform or stitch together a collection of solutions that can address the myriad needs of an individual employee. And today we'll explore this concept. We'll dig into how employers are approaching chronic condition management solutions and wellness solutions and preventive tools, how they're aggregating point solutions to provide whole person care. We'll explore these questions from both a macro perspective as well as that of an individual company and from the point of view of a solution. We've got three leaders with us today to have this conversation. Ben Hagan is Assistant Vice President for Benefits at AT&T. He and his team have responsibility for global benefits for the company's 230,000 employees and their families, and he provides additionally governance oversight for all suppliers across human resources. Ben is also an actuary, so he'll help us stay honest. Ben, thanks for joining us. Next, we have Stephanie Kovalik, who is the Chief Strategy Officer for Sage Growth Partners. The firm has deep expertise in healthcare and works with clients across the entire spectrum of healthcare and life sciences. Stephanie is responsible for building their growth strategy as well as leading the strategy consulting team. And finally, we have Glenn Tallman, who is a prolific entrepreneur and investor. He founded Livongo, which was acquired last year by Teladoc. He previously grew Allscripts into a $1 billion public company. He's a co-founder and managing partner of Seven Wire Ventures, which invests in healthcare companies. And he's also started a bunch of companies outside of healthcare. Cooler Screens has raised $100 million to bring interactive screens to store aisles. Argo Tea, which many people have probably heard of, a solar energy company. But more importantly than any of that, he serves on the board of directors of MATTER. Glenn, thank you for joining us. For today's program, we're going to start with Stephanie, who has recently done research into how employers are approaching health and wellness solutions and how they're approaching this notion of whole person health. Following her presentation, I will moderate a conversation with her and with Glenn and Ben. So with that, Stephanie, I turn it over to you to share your research.
Great, thank you, Stephen. I appreciate it. I am the Chief Strategy Officer for Sage Growth Partners, and we are a healthcare-focused market research, go-to-market strategy, and marketing communications firm. We're in Baltimore, Maryland. And we do a lot of primer market research on various topics in healthcare and really focusing on how technology plays a role in driving better outcomes for everyone. It's been a pretty interesting time for digital health in the last couple of years. So we've seen increased activity in our client base around digital solutions. We've seen an increase in interest in how self-insured employers are looking at digital health components of their benefit package. As we looked at these trends, we got particularly interested in how the employers are really thinking about integrating them into their benefits package, how they're looking at making decisions around that. Some of the trends that we thought were pretty interesting are, first, there's an app for every condition, right? Diabetes, weight loss, joint pain, medication management, mindfulness, exercise. In fact, there are multiple apps for every condition, and we've seen this explosion of solutions on the market, and each one of them focusing on their own thing. It can be overwhelming. It's overwhelming for us to look at everything that's going on in the market, the different technologies, trying to figure out who's going to rise to the top and how it's really going to materialize in beneficial solutions across the board. We sometimes like to think of ourselves as helping to solve healthcare challenges one vendor at a time, and how do these vendors really contribute to the overall progression of healthcare in the United States. So that kind of app for every condition and that explosion of technologies that Stephen mentioned and referenced is an interesting environment in digital tech today, or digital health tech today. The second trend we are looking at, and we've had a lot of folks come to us in this space from a technology perspective, and they struggle with kind of the same thing. It's a B2B2C world in this digital health environment. So, you can take an application or technology and sell into a payer or a self-insured employer, and then you need to get one level deeper and get to the employee or the employee's family. So that engagement is really key. And seeing how the adoption and the engagement and the stickiness of these solutions plays out over time is interesting to see how digital tech is really going to help change and the trajectory of where healthcare costs are going, and chronic condition management, and any number of things, right? So that B2B2C process is particularly interesting to us, and how you get kind of through that that environment, or through that landscape from technology to engagement of the employee or the person. The third trend we are looking at is the pandemic, right? So the COVID-19 propelled a big shift to digital health. We've seen these solutions on the market for a long time, and essentially we saw healthcare and access to healthcare slow way down, increasing the demand for virtual care solutions, be it telemedicine or chronic condition solutions, or other technologies that allow people to take more control of their health. And lastly, this fourth trend is all around behavioral health. We kind of see behavioral health as a sleeping giant of chronic conditions that's really started to wake with COVID-19 pressures. And it's the critical link between physical and mental health that's really becoming evident and the forefront of the landscape today. So these four things create this interesting environment. There are more trends, but these are the things that we really looked at that made us want to get a little bit deeper into the research, right? So we wanted to talk directly, we do a lot of primary market research, talk directly to the benefit leaders and the HR leaders at large self-insured employers, and see how they're thinking about digital health and how they're integrating these solutions into their health benefits package. So we published this report not too long ago, filtering through the noise, what employers want from a chronic condition management solution. So I'll talk a little bit about the research in particular. So we had some core objectives in the research, and they're listed here. One is to really assess the role of digital health solutions in the overall benefits offerings of these large self-insured employers and payers, essentially, right? Understanding the perspective of these employers in managing chronic conditions, and really exploring how they're navigating this growing number of potential solutions on the market, and how they're making those decisions, and essentially identifying who's going to align best with their employee population and their benefit package overall. So we conducted this research last summer, and it was a combination of qualitative interviews. We interviewed about 15 benefits and HR leaders across big self-insured employers, and we surveyed 230 large HR and benefits leaders from 230 large self-insured employers. And we saw that largely the respondents represented benefits administration within finance and human resources functions. And like I said, the data was collected in the summer of last year. So it was kind of mid-pandemic, maybe not mid-pandemic, but it was, several months after the pandemic had started. So we had the opportunity to assess, some of the interviews were done prior, and then we did more in the middle as pandemic progressed, and the survey was conducted during the summer of last year, like I said. And so we had the benefit to see how some perceptions were changing as COVID-19 really started to leave folks working remotely, higher levels of isolation and loneliness and anxiety, and gave us a sense for where things were starting to fall or thinking about falling. So I'll run through some of the key findings that were interesting. One of the first things we wanted to understand from these benefits leaders is what drives and influences decisions about health benefits for their employees and their employees' families. So we asked what were their priorities relative to health benefits. Not surprisingly, controlling medical and pharmacy spend really topped the list, right, along with improving employee wellness. The third one on this list, attracting top talent and keeping employees satisfied. Employee satisfaction, you can see on this chart, is kind of fourth on the list, or third if you're combining medical and pharmacy spend. And in a different question in the survey, we asked if benefits overall was leveraged as a differentiator in a crowded employee market. And the predominant answer was yes, but it's not the health benefits themselves that are differentiating. The focus for the health and wellness benefits are really, again, founded in looking at controlling the medical and the pharmacy spend and improving employee wellness. Again, not surprising, but a foundational element to the research. We then also wanted to understand where benefits leaders were focusing their efforts relative to chronic conditions. So how are they thinking about that? We see the usual suspects topping the list, right? Diabetes, weight management, heart health or cardiac health. And then we see some up and coming conditions. So behavioral health and chronic kidney disease were both very important on the list of chronic conditions to be managed. We were a little surprised to see chronic kidney disease kind of coming up on the list, but we've done additional research that really validates this. So it's really interesting to see. And the behavioral health component doesn't really surprise us. And I don't think should surprise anyone. Like we were talking about, or I was talking about earlier, that behavioral health becoming kind of that sleeping giant of chronic diseases, and then integrating it. There's this big connection between physical health and mental health. And in this last 12 months in particular, we've seen people just be in an environment that makes it more difficult and challenging for them to operate and function as they had before. So seeing that rise, seeing that elevate across the market. So as we went through the survey, we really wanted to understand, and through this research, what were some of the barriers in adopting or offering digital health solutions for chronic condition management for the large employers. And there were three things that really stood out in the survey and in the qualitative interviews as barriers to adoption. One is that lack of employee engagement, right? So they are hesitant to make investments in solutions if they don't have some level of confidence that there's going to be a strong ability to engage employees and their family members in the process to manage their chronic conditions. So lack of employee engagement is number one. Then there's lack of budget or perceived ROI. And that perceived return on investment kind of goes hand in hand with the lack of employee engagement. So if you're not getting employees engaged and you don't have a stickiness factor with a particular digital health solution, you're not going to get that long-term impact or effect of managing that condition over time. And then the third was kind of this hassle factor of dealing with multiple vendors. And maybe it's bigger than that, right? It's not just hassle with dealing with multiple vendors. Certainly that's part of it. But more importantly, it's really having the multiple vendors. When you look at these chronic conditions, they're all linked, right? You very often have hypertension and diabetes and obesity or kind of weight management issues all tied together with also a behavioral health component. If you have a person with these conditions, they're going to be less likely to stick with 4 different solutions to help manage each of them than they are going to have an integrated solution. So there's twofold on the multiple vendors, and I think it relates to all of these: the employee engagement, the lack of ROI because of a lack of engagement, and that hassle of dealing with multiple vendors that the benefits leaders are really thinking about. So it was really interesting to see all this tie out, and we had some really interesting qualitative insights from the interviews that we did as well. So I think lastly, essentially our research illustrates the need and the desire for a whole person approach, right? 71% of our survey respondents said it's very important to have a single vendor integrated approach, as it kind of eases the workload. But again, as I just talked about, more importantly, it creates an environment that fosters employee engagement and ultimately better health. And that's it.
Well, Stephanie, thank you so much. It is great research. Let's bring Ben and Glenn into the conversation. And I think what's interesting about the discussion that we can have is that, Stephanie, you really provide a macro level perspective. You've done this, really current research with employers. Glenn, you've been innovating in this space and build solutions and business models that resonate with employers. And Ben, you've been buying solutions. So Ben, I'll start with you. And you just saw what Stephanie presented. Her last slide, she pointed out, says it's 71% of employers didn't quite say 71% of employers won't consider chronic condition solutions, but that was a little bit the implications of it if they're not part of a more holistic platform. Does that resonate with you? If you'd been surveyed, maybe you were surveyed, but how would you have answered that question had you been part of that survey?
Yeah, no, I think that's a great place to start. And I might even take a step back and say, when this presentation was sent out, I had former coworkers, former consultants, and everybody in between say, what did AT&T do to solve this Rubik's Cube? Because the way it's titled, it looks like we did something magical and we solved all the problems. And I would start out and say, we haven't solved anything. We might have a point of view on how we look at the marketplace, but it's certainly not the end all be all. And so just want to kind of set that up as the start here. But, when we think about the various platforms, I think we kind of think about it in two lights. One, from a just pure operational standpoint, it's a lot easier to contract with one thing across the entire board, and it solves for all the problems. I think that the flip side of that is that when we do that, you might not get best in class, and I know that's a buzzword that a lot of people use, but you might not get a best in class solution in any one of those. And I go back to where we came from, in that prior to the last 5 years, let's say, the solution was you buy a mile wide, foot deep solution from the carrier. It tries to take care of all your care management programs, and you're checking the box and away you go. Now, I think that maybe the jury's still out. Maybe the jury's starting to come back in and say, that didn't really drive the results we wanted due to perceived bias from the payer, perceived bias from the member thinking, oh my gosh, my carrier's calling me, they're going to deny a claim instead of actually making me healthier. And so when we think about it, I think, moving towards those point solutions, trying to put them in a platform makes a lot of sense. However, we would even take it a step further to say, our members, and no offense to anybody on the call, but our members don't care that it's branded Livongo. They don't care that it's a Livongo competitor. They want it to all plug in together and be seamless, but be seamless in our ecosystem, and that's different than seamless in our competitors' ecosystem and everybody else's ecosystem. And so when we think and kind of push the market, that's one place we're trying to push, is that agnostic view to where the platform we're trying to build is different than everybody else's, but it plug and play with the best in class solution. And so it's trying to balance all those things together, which I know is, an impossible Rubik's Cube, more than a 3x3, says the actuary, but just trying to work through some of those issues and solve for some of those problems.
Yeah, well, first of all, I was sure that you had completely solved this issue for AT&T and that you were going to share with our audience kind of this fabulous holistic solution. But nonetheless, I think you have really approached it from I think a really realistic and pragmatic point of view. And it was interesting. I like what you said, that there's this balance between trying to get best in class solutions versus getting one solution that maybe is really wide but doesn't necessarily accomplish anything. So, Glenn, curious your view what's happening in the market, generally what you've seen since you went out 6-ish plus years ago with Livongo, and how the market has evolved with regard to this notion of whole person solutions for chronic conditions.
I think Ben described it appropriately, and that is we had a global solution that did everything but nothing very well. So a mile wide, 1 inch deep. Then we went to individual solutions, and you recall, because you were there at the beginning, Stephen, when we talked about Livongo, and it was specifically for diabetes. Then very quickly we found that people with diabetes, our members said, that I also have hypertension. I also have a weight management issue. I also have behavioral health issues. And they actually ask us, because 70% of the people with type 2 diabetes also have hypertension. They said it would be great for us, for our experience, if we had one place to go to solve more than one problem in a quality way. And so that drove our expansion. It was actually driven by our members to say, do more and more and more. Some of that we developed at Livongo, some of that we actually acquired because there were best-in-class solutions that were out there and available. So we started to expand and move to that whole person platform. And frankly, if we go full circle, we were getting calls in the middle of the night, and people were saying, hey, I have a sinus infection. We'd say, why are you calling Livongo? We're the chronic condition management people. And they would say, because you're the only people who pick up the phone. You're the only people who we trust. You're the only people who actually solve problems for us and don't worry about co-pays or policies. And that, in fact, drove our combination with Teladoc, because we could be a one-stop shop. Now, that said, if we look back at the history of other software development, it starts off with either no platform or things that don't work well. People say, I need better solutions. So, probably the best example is Microsoft Office. Before that, some of the people listening can remember Lotus, and some of the people listening can remember WordPerfect and other solutions. And then Microsoft came along and said, let's put them together. Let's make it easier for you in something called Office. And we said, well, it may not be as good as the individual solution, but it's good enough. And I think that's kind of what Ben was talking about, which we're to a point now where people are saying, make my experience better. That's the most important thing. Make it easy for me to stay healthy, and give me a platform that does that. It has to be better than what the payers traditionally provided. And that's, I think, this next generation of very experience-focused platforms that allow you to solve your healthcare challenges. And it's one place to go, it's easy. And it has to also meet the employer's concern of, do I get enough value? And value is that combination of quality, it's clinical outcomes, and cost. And what's that trade-off? So I think that's where we're headed, which is much more platforming of the experience and much more listening to what do people need. And we've been given this wonderful boost. Maybe the only good thing about COVID is people have been thrust into using digital. They've tasted that experience and they like a lot about it. So now it's our job as an industry to say, how do we pull out the best of that and make the experience just like it is in everything else we use digital?
Well, I still have a bunch of WordPerfect files on like floppy disks, and I'm not sure exactly what to do with them, but I do fondly remember that word processing program. And it makes me think, so who's going to solve this issue? Is it, obviously one answer could be that the Teladoc Livongo combination is the answer, and there's going to be, 2 or 3 of those kind of combined entities, and people like Ben aren't going to be picking from a whole constellation of solutions unless they plug in somehow, or are like who's most likely to solve this issue at scale?
Well, I think the reason that we merged Livongo and Teladoc together was to create a one-stop shop for a virtual healthcare experience. And that's not going to be all digital, by the way. It's meant to be high touch and high tech. It's meant to say you can start completely digital, you can talk to someone on the phone, or you can go and see your physician or other caregivers. And we aren't going to think about digital solutions and in-person solutions. We're going to think about how do we meet people where they are and provide the best healthcare. And what I'm excited about is employers like AT&T are driving that revolution. It's not going to come from the government, and it's not going to come from other third parties. It's employers saying, we need to take care of our people, but we need to do it cost effectively. And so I think you're going to see a real movement toward value, and it's going to be this combination of better experiences for our people and high value. For example, one of the things Livongo pioneered, and I know in our negotiations with Ben and his team, they said, we only want to pay when our people use it. We don't want per employee per month. That's the old way. We want per participant. We should only pay when they use it. And furthermore, we'd actually only like to pay for results. So I think you're going to see more and more movement to say, hey, if it works so well, let's partner. Let's really partner, go at risk. And if it works, we'll share some of the savings with you. And I think that's this next generation that's post-platform, which is how do we envision these care models in really ways that share the benefits? Because that hasn't happened. I mean, I think in your introduction, you talked about the fact that in 20 years, if you look at healthcare today, it's more confusing, more complex, and more costly than ever before. We've had all this innovation. How could that be? If you ask the average person, they have no better luck, navigating the system. And then there's companies out there that say, we'll be your navigator. It's like in the old days in my electronic health record life when people said, we'll hire somebody to input into Epic. And it's kind of like, really? So shouldn't we just fix the software? As opposed to saying, we're going to have somebody, it's kind of like if you break, somebody breaks glass on the floor, you say, we'll clear a path and we'll have somebody show you through the way to clear that path. As opposed to saying, no, let's sweep up the broken glass. Let's fix the systems. Let's make them so valuable. Like nobody has to, we don't need an engagement program for Google or for Airbnb or for Uber. You use them because they're valuable. We need healthcare programs that will be just that valuable.
I want to come back to engagement. I want to come back to value and the kind of business model. But Ben and then Stephanie, I want to dig in a little bit further on this notion of kind of piecing solutions together and really who's going to solve that. And Ben, I'd love your view on it from the chair you sit and kind of buying these solutions. How has the world evolved over the last 5 years? And if you were to prognosticate over the next 5 years, where do you think the biggest traction is going to come? And then Stephanie, I'd like to toss the same thing to you based on the research that you did and all the conversations you had with so many different employers.
Yeah, I think your initial question was right about who's going to build it. The suppliers or the vendors are doing it, right? You see it with Livongo and Teladoc as an example. They will be one of probably a handful who come up with solutions that look like, here's the off-the-shelf solution. We'll take the whole person view. I think that will be good, great, sufficient, whatever level it is for a certain subset of employers. I think then that there's also another subset, whether it's large employers, complex employers, the intersection of the two, that will have to continue to build it themselves. And so it's more of a, if you build it, we may come, or said differently, yep, we like your out-of-the-box solution. Now let's put it back on the shelf and let's partner together to build something together that looks good for our ecosystem and our needs, because our needs as a company are even different than our direct competitors. So think Verizon or Comcast our needs as AT&T are different from the two of them, and we're essentially doing the same type of work. And so we have to think about building our own platform to address the needs of our people. And we're all going at it at different times and different angles. To Glenn's point, some are starting with the navigation on the top and then building things on the bottom of it. Some are starting on each individual to address specific cost issues. And so we're all going about it in a different way. And to be honest, there's not a singular solution or a singular platform or a singular point solution that all of us are going to navigate towards. And so it's, once the market kind of understands that, I think it creates more partners for us and less people, to Glenn's point, they're just trying to sell us a PEPM model that may or may not get people to it. Because again, even with the engagement piece, and I know we'll touch on that, it's if you build it, they may come. And, the strategy of hoping or prayer that they show up at the door, I think we're past that. That's where we've been. We need to move on to the next generation. I think to your other question, the next 5 years is us solving for those issues and getting people in the door, knocking down all the walls and creating a seamless integration across all of our different ecosystems. And it's an impossible ask, but I think we get there because we have to.
Stephanie, anything that you've seen or other employers you've talked to with a view on this question?
Yeah, so we in the research and other research that we do, we've talked to lots of benefit leaders, and I found that they all fell into maybe one of two or three categories. One is, they're very focused on cost, and they say, hey, look, our type 2 diabetes population is costing us the most money. That's the problem we want to solve, and we want to have a big impact on our medical costs that way, or our pharmacy spend. Then on the other end of the spectrum, you have folks that are saying, hey, look, we are looking at our employees as population as a whole. Yes, medical spend is important, but so are some of these other things, right? We want happy employees, we want healthy employees. We want to make sure they're not sick and they're coming to work every day. So we really want to address this broader spectrum. They're a little bit more innovative in how they think about their benefits, right? It's not just something to reduce costs, it's something to create a larger ecosystem for their employees that solves lots of problems, not just reducing medical spend and clinical spend. And I'm thinking back to one interview that we were talking to an employer who had started with diabetes, right? They and it might have been Livongo. I'm not sure. So all these interviews mixed together, but
Probably was.
Wanted to solve the diabetes problem. And then they said, but hey, we have a bigger population of pre-diabetics, and I don't have a solution for them, and I don't really want to go get another solution. I wish my current vendor could help me solve that problem. And then rolling in hypertension and rolling in others. So we're seeing that broader ecosystem. And in the conversations when we talked about single vendor, really great point solutions versus a broader solution, there were two schools of thought there. One kind of on the innovative side is, look, we would love a vendor who can give us this whole person platform and help me connect it, because we know that, you have a person who's type 2 diabetic and has hypertension. It's not three separate populations. It's largely the same population, and they want to be able to manage all of their conditions together in a single solution. But then there's a secondary concern of saying, but I love my diabetes vendor so much, I'm afraid if they do more, they're going to dilute their kind of ability to really help the diabetics, right? So thinking about its proof points, we always, in any technology innovation, it's identifying the pain points, and it's kind of following and connecting the money. So how can you illustrate that you can solve the problem effectively for the majority of population and deliver that ROI? And I think different employers look for different things, and we've seen them both.
So going back to something that in your research, I think you just touched on, was that the top barrier that you identified to adopting digital health solutions for chronic conditions, it wasn't actually the challenge of multiple solutions, although it might be related to that, but it's lack of employee engagement.
That's right.
And have you seen any, and Glenn, you mentioned engagement also, and have you seen any particularly effective approaches that would be worth calling out?
I think all of the three barriers relate, right? And that the lack of employee engagement and the lack of perceived return on investment and the multiple vendors, right? It's really hard for me to separate those as we work through it. So if you look at solving a problem kind of with a single solution, right? It might be great and easy to drive toward adoption with a single point solution. But then as you start to add those on, it becomes increasingly difficult for people with multiple chronic conditions to kind of manage that. I think, Stephen, it's really hard for me to separate those three barriers because they all relate so closely. Lack of ROI is because of lack of employee or member or patient engagement. And that also relates to the third, which is that multiple, chronic condition. So what we heard employers say is, look, if somebody can help me solve all three of these, somebody can prove member engagement for my people, my employees with diabetes, my employees with hypertension, my employees with these, with behavioral health or, anxiety and stress and depression together, and illustrate that there's a stickiness factor that generates an ROI. It helps me answer those questions and feel confident that this single platform vendor is optimal and can help us solve our problems and challenges.
Yeah, I'd love to give two examples of that. One specifically, the integrated solution around Livongo, and certainly not as a commercial, but as we receive feedback, the connected device, all of it going to one place, getting that holistic care. We've received feedback even within the last couple of days from various members or employees about how great it is to have all those things in one place and to show it to their doctor and just check the box right off the bat. So that drives engagement from kind of a grassroots effort. So I think you can start to get there. But similarly, in our kind of family planning space around fertility and family planning and those, we have a couple different vendors. And those vendors, while they both have solutions that they would love to turn on a holistic solution in the space, they've done a magnificent job, thanks to pushing on our side, but thanks to their willingness to do it, to integrate with each other in our ecosystem. And we get the same feedback from those two integrating with each other, doing warm handoffs with each other and making it seamless for the employee. So if they call one, they'll get to the other one very quickly and vice versa, making sure that the right people are answering the right questions. And so I think either one of those methodologies work to get there, but you have to do one of the two. Otherwise, and we see it in our people, they just don't engage at all. They're just gonna, roll into a ball because they don't know where to go. So they go nowhere, almost an analysis paralysis impact. And so I think, and that's why we think about it as, white labeling everything would be beautiful for us because our employees don't care. They don't care what name is on what device is on, who are they calling. They want care, and they want it now, and they want to integrate it in with their doctor if they have one, and if they don't, we need to help them find one. And so it's kind of that full integration of everything. And I know that's a challenge. That's a challenge because sharing data across platforms is a challenge. Think about sharing data from the payer to these platforms, back to our warehouse, and everywhere in between. That's an impossible challenge right now because everybody thinks data is currency. And so I know we can double click on that all day long as well, but it's certainly a challenge. And once some of those walls come down and realize there's enough money in this system and enough waste in this system to where we're all going to be winners with the right solutions, and we get past that, maybe we're onto something and maybe we are truly solving the problem. But until then, I think we're going to still have some infighting to get there.
Stephen, I would just add to that at Livongo, from the very earliest days, we made a very significant investment in data science. And that allowed us to drive our rates. And remember, Livongo was all opt-in, but it allowed us to drive our utilization rates on average about 37%, but between 37% and 50%, which if you compare something like telehealth prior to the pandemic, that was 3 to 8%. It's almost a 10-fold increase. So how did we do that? Well, our data science did the same thing that when you go to Amazon and they say, people like you like books like this. people would get on the Livongo system. It's very personalized. It's this AI engine that's constantly learning from itself. So we're saying, okay, a 21-year-old male in Texas is very different than a 52-year-old woman in the Northeast. And even in Texas, you know, a male and a female are different. So everybody's going to get different messaging. We know the parent of a child with diabetes looks very differently at the issues versus someone who might be challenged economically. And they say, wow, I get strips that don't cost anything. That's really helpful to me. Other people like the data sharing, as Ben was talking about. So we invested very heavily in understanding, kind of meeting people where they are. And just give you a fun example. Initially, when we started, we talked about diabetes in the South, but it turns out people in the South don't have diabetes. They have a touch of the sugars. Now, some of us might smile at that, but in fact, they think that diabetes is a bad disease, and lots of people have a touch of the sugars, which is diabetes, and they would much rather engage in a solution for that. Similarly, people don't like their chronic conditions. So, you know, they don't want to be called. They don't want to say you're a cancer, you're a diabetic. They don't want that. They don't want to be constantly reminded of it. They just want you there on their terms when they need it. So I think, you know, as you get more personalized, as you understand how to really address what their needs are, that's the best way to drive utilization and drive value. And too often we're trying to incentivize people to use a system that they say it's not really that good. You know, like I don't want to, like somebody said, we're trying to drive more people to our website. The answer is why? Why do you want to get them to go to your website? Like they should only go if there's a reason. Like don't try to get them to go. Like I don't want to go, no offense, I don't want to go to my payer's website. For what? I just want my problem solved. And I don't care, and Ben was right, as painful as it is, you know, they don't care what the brand is. And we've never tried to build a brand. We just want to solve their problem. You know, our president, Dr. Jennifer Schneider, you know, she had diabetes. My son had diabetes. This was about how do we make their lives easier? Not can we get them to go? Can we make more money? None of that mattered to us. It was really simple. And that's, I think, why it was successful. And so we have to get back to what problem are we solving and how do we make it just easy? Because that's what all of us want. Nobody wants to be in the healthcare system at all. They just want their problem taken care of. That's why Americans are particularly not good about pre-registering, entering their data, fill out this form. They don't want to do any of that. They just say, when I have an issue, be there for me, make it go away. And that's what our systems, that's why I think, you know, when we look at a Walmart and Amazon, they are going to be players, and they're going to be players because they know how to focus on what customers want. And that's where we have to get to and keep getting there in healthcare.
So I think I love the way you characterize what people want out of healthcare solutions and some of the challenges and some of the differences, because it's not like, you know, you talked about Google earlier, like they don't have to sell engagement because the value is so obvious that people want to go there. And that's one of the challenges that a lot of healthcare solutions have faced. And I think it's fair to say that we are slowly moving, you know, and Ben, I'll direct this to you. I think we're kind of slowly moving in a direction where quality and value are important measures of success for healthcare solutions. And, you know, from your point of view at AT&T, you know, how do you, and this is a question we get all the time from entrepreneurs, is you know, what's the best way to measure the success of solutions? And, you know, what is a strong ROI to you? Is it that, you know, you reduce rates of absenteeism? Is it that you save dollars? Is that, you know, what is it that's going to be that's going to be great. And I guess just to push it all the way to the extreme, you could have like a video game solution that would have 100% engagement because it was just so fun to play, but it wouldn't have any meaningful impact on the measures that you're looking at. So where is that balance, and what are you looking at?
Yeah, and I'll caveat this with you introduced me correctly. I am an actuary, so the softer side may not be there. So I apologize for that. But when we think about quality, we're thinking about outcomes-based quality, true clinical quality, and not Yelp scores. I think that's the first thing to make sure we're all talking about quality in the right way, because if the doctor, the solution, the whatever has the best People magazines and the best parking and the warmest hands, that's not going to get us anywhere. That might get short-term engagement just because it feels good, but if he's using the doctor solution, if it's Dr. Death, suddenly we're paying a lot more. So we need to all be thinking about quality the same way. I think the question about ROI, it stems from quality. And so if you are truly driving quality and you have, you might pay a little more in the short term for that quality, and that's okay, because in the long term, you're going to get clinical ROI return on that. And so when we think about return on investment, some of the softer absenteeism, presenteeism, and all of those pieces to us, those are nice to haves, but those are nice to haves when we're not about to go through a recession. So if we had a 2007, 2008 again, all that goes out the window. And, I know that even in the survey that we walked over at the first of this, we talked about kind of wellness, satisfaction, wanting to be a differentiator amongst your employees and across your employers. I think a lot of that lowers in priority if we go through a more difficult financial time, where if you have a true ROI where you're driving medical costs out of the system, or you're bending the trend curve as it relates to the entire ecosystem, those are the solutions that are going to stay. And so, that hard ROI is, I think hard ROI is the way to call it. That coupled with and Glenn touched on it earlier, not the PEPM, but the utilization-based pricing, because, a lot of people worry about utilization-based pricing. What if we have a run on the bank? Great. If we have a hard ROI that goes along with that run on the bank, give me 100% utilization of the benefit, because that's going to drive a lot of the cost out of the system. And so I think that having those two together is extremely important for us, and making sure that we can prove it independently of the vendor as well. And so to that point, it's ensuring that all that clinical data is transferred on an individual basis back to, whether it's our data warehouse, whether it's the consultant's data warehouse, whoever it is, so that can have an independent view to say, is that really an ROI? And do we agree that in the methodology on how that's calculated? Of course, following all the HIPAA rules and all that. I'm not asking for somebody to send me all this HIPAA data and Social Security numbers and things like that, but making sure we do it in the right way, and we do it for the benefit of the plan and the plan participants, I think is the right way to think about that. And then the last piece of that, we talk about all this clinical ROI and clinical engagement and quality. To me, those solutions then need to be integrated into a medical program. And so I know a lot of these solutions want to say, oh, we're just an EAP. And for all the people who don't know what that is, Employee Assistance Program goes out to everybody. That sounds really great. You want access to the Queen Mary. I know you want all 230,000 of our employees to show up on your front doorstep. Well, unfortunately, they all don't need to show up on your front doorstep if it's the right solution. And so integrating in with the medical plan, thinking of yourself as potentially as a business associate of the plan. For all the people who don't know what that is, good luck. But thinking about things that way, especially if you're providing a clinical ROI and you truly want to integrate in with the benefit plan, the benefit program solutions, you need to get into that medical space and kind of abide by those rules and think about it that way. And that's difficult for a lot of people and a lot of solutions to think about, because they want the easy way in, and which the easy way is PEPM, give it to everybody. Well, that sounds great for you, but anything times 230,000 is a big darn number. And I don't think we're interested in paying that. And I know there's a lot of people who aren't interested in paying that as well, especially if there's no hard ROI that goes along with it.
I also don't think there's good alignment, Ben. So I don't think it's best for the businesses. When we started our model and said, only pay us when people use it, and if they stop using it after a few months, stop paying us, our investors weren't really enthusiastic. They kind of said, are you sure And I said, look, at the end of the day, we don't have a business if people don't want to keep using it. And that should be our focus, which is how do we do that? And the other piece was we had a lot of folks, actuaries, data scientists, and people who were driving a hard ROI, and even employee benefit consultants who looked at it and said, look, this is actually driving down cost. And so, when people talk about the success, you need both. You need people to use it, but you also need to be able to measurably show, because it's been way too long where we accept healthcare as just this thing that every year costs more, and that the quality is not determinable, and nobody's happy with it, and it's going to change. And my big question is, are we going to wait for somebody like an Amazon or a Walmart to change it for us, or are we going to do it ourselves? And fortunately, again, AT&T, other leading companies are stepping up and driving forward, because that's the only way it's going to happen. It's, there is a lack of alignment today. If you look at payers, PBMs, and health systems, when you spend more money at AT&T, all three of them make more money. There is never going to be a situation where they come in and say, we're going to cut our revenues in half this year. That's our goal. It's just not going to happen. So somebody else has to do it. And, and I think business is concluding increasingly that they're going to have to step up and get a hold of this, either with partners or, in other ways. And I think we're going to see a lot more risk sharing as well.
So I had a little internet of a fritzy situation there, so I may have missed something. But one of the things I wanted to touch on, which I think is a segue to kind of where we were, is on this notion of quality, and it's sort of tying into value, and kind of like who's measuring quality and who's deciding what that is. And Ben, from your point of view, how are you? How do you approach that? What is the what are the quality metrics? Obviously, you're an actuary, so you're well positioned to do this. But how do you do that? And then Stephanie, if there's time, I'd love your take on that as well.
Yeah, I think that's the billion-dollar question that you just asked: is how do you measure it and who measures it? There's enough data out there and various data sets and cobbling them together and truly doing so in an unbiased way, where you could get to quality of anything and quality of outcomes, even seeing how people move once they engage with some front door or some solution or some whole person solution, what actions they take next. And I think there's a component to quality there as well, because it should be driving quality downstream and less about, who's on the front of D magazine, local Dallas person, of course, or, who do I play golf with on Saturday? And thinking about it more of true outcome-based quality again. So those outcomes of, is the person getting healthier? Are we not doing readmissions? Are they, spending less? I mean, risk score is a good example of one way to do it, but not the end-all be-all. So, but I certainly want to give Stephanie some time here, because I know we completely monopolized the conversation.
No, that's okay. I think that was, I think it's been great. So I would say, just to echo Ben, certainly there's the specific measures of quality and outcomes, and measuring, results of, patients' blood work and, ongoing clinical measures as a result of quality outcomes. I think on the more emotional side of quality, and the interviews that we had with the benefits leaders, there's an element of, and I don't know, Ben, how you would see this, but what we heard a lot of folks that we talked to is, when my employees call me and tell me how great this is, then I feel like, that's a, it's a soft ROI, right? You feel like you're doing something good for your employees. So if they take the time to reach out independently and say, I love this solution, it's really helped me, I've lost 10 pounds, my, blood work is great, then then there's something special there. So that's how we've heard it.
Yeah, and I think you hit on the key point, which is, it doesn't make, they don't tell you because they like the colors or it feels good that they have this solution, or that it's, oh, you gave me Livongo and I saw them in the news type of thing. It's I'm seeing improvements in my health, which is we know is driving a hard ROI somewhere. I think that's critical. It's a critical point to tie together because again, the actuary in me wants to then tie it back to the hard ROI and forget the soft stuff. But yeah, I agree. The soft stuff is important because the person does feel better when they're getting healthier. And to Glenn's points, they're getting holistic care and they have that one source, whether they wear a white coat or not, that you can call and they will solve that problem in a very quick amount of time.
Thank you very much. All three of you are at the top of the hour. Really appreciate your thoughts. I love this kind of conversation where we've got such different perspectives on exactly the same, or such vantage points on exactly the same issues. Thank you to everyone for joining us, and I hope that you all enjoy the rest of your day.